Complement. I think this is a great question, and it's really a moral issue at the stage we live in. Because I think in an ideal world, we would be seeing a different scenario, right? We would be seeing a scenario where we're understanding that we're living through a global crisis, and that we need, no one's safe until everyone is safe. In an ideal world, we would not be seeing what we are seeing right now. And WHO worked and partners worked days and days and days to ensure that we put a framework in place that would allow for a timely access to all countries, independent on income or availability of resources, right? But the world we live in is not a fair world, right? And I'm saying this because the COVAX facility is a way for us to reach fairness, and we are going to get there. And we have, like Dr. Sumia was saying, there are vaccines that are friendlier to the low and middle income countries' environment, the logistics that are needed to ensure coverage and to ensure that the countries can actually use the vaccine in the priority populations and so on. These vaccines are on the way, So what we have is a gap in time, right? When we have now I think it's 46 countries have started vaccinations, and out of these, I think 38 are high-income countries. COVAX facility is there to ensure we can correct the course and make sure that all countries have access to safe and effective vaccines. This is not happening now in January, but it's happening quite soon, and we hope to have good news for you on this in February this year. Thank you.
Thank you, Dr. Simão. I would like to make a second attempt to reach Bianca Rothier from Global. Bianca?
Hi, Fadela. Can you hear me?
Now, very well. Go ahead, please.
My apologies, I had a technical problem here. Thanks a lot for trying again. My question is about Brazil. As UK suspended new arrivals from Brazil over fears of a new coronavirus variant that was detected in Japan from travelers from Amazonas, the Brazil's largest state, because in the same state, in Amazonas, hospitals are overwhelmed, collapsing. We have reports of patients dying of suffocation without oxygen. So the state made an urgent call for help from abroad. Is WHO aware and prepared to help? Does WHO believe that the new variant could be helping to these sharp highs in cases there? And what do you know about this new variant? Is it more contagious as the UK variant, for example? It seems a lot of questions, but they are all related.
Thank you, Bianca. Very well understood. I would like to ask Dr. Ryan.
Hi, Bianca. Yes, we just a lot of questions in there. Yes, we do have a WHO team on the ground in Manaus. And we have been working very closely with state level and federal level authorities over the last number of months. Our regional emergency director, Ciro Agarte, our incident manager, Sylvan Aldeguerri, our country representative and others are working very, very closely with our colleagues in Brazil at federal and state level. You are correct, the situation in Amazonas and particularly in Manaus has deteriorated significantly over the last couple of weeks, but that's not the only area. Other areas in association with the Amazon have had big problems in terms of their ICU capacity, Rondonia, Mapa, very high rates of positivity, and in this case 30, 54 and 46% respectively. So this isn't just an issue in Amazonas, it's not just an issue in Manaus. This is an issue in many areas of Brazil and in many countries in Central and South America. Again, a bit like some of the countries in Europe, like my own, the holiday period has probably resulted in many people mixing in a way they haven't mixed before. And certainly this is not the winter period in these parts of the world, so that's not the factor driving things. And it remains to be seen to what extent variants are driving that disease, and Maria will speak to that in a minute. There has been a rapid case of hospitalizations reported in Amazonas since the middle of December. Most of those cases are in Manaus, the capital of the state, but they're increasing in other municipalities as well. And clearly, if this continues, we're going to see a wave that was greater than what was a catastrophic wave in April and May in Amazonas, and particularly in Manaus, which is a tragedy in itself. The ICU occupancy right now in Manaus is 100% over the full last 2 weeks. This is a health system under extreme pressure. More than 4,000 new COVID-19 cases and 50 confirmed COVID-19 deaths per day have been reported. Over 2,000 people hospitalised, both suspect and confirmed, and over 400 people waiting to be hospitalised who already have COVID. There are many, many responses going on. The local response team, the incident management team, and many others are doing all that they can to continue support. But you are correct. There is a shortage in supply of oxygen. There's a shortage in gloves and basic PPE. And there's difficulty in transporting oxygen from other states into Manaus. But oxygen is not an easy thing to transport. It's heavy. It's usually in these big cylinders. They're weighty. And I'm sure other states and the federal government will come to the assistance of Amazonas and Manaus. Brazil is a country of great solidarity, and I think we will see that happen. Another problem, and this is one thing that happens, we've seen before health workers being infected, frontline health workers. Of note here is that many, many surveillance officers are now affected by COVID-19. Many of the laboratory staff have been affected through community transmission. And this is a situation where your whole system begins to implode because your hospital system, your public health system, your laboratory system, those people are part of the community themselves. And they begin to become infected. And you go into a negative spiral. There's over, I think, a backlog of 7,000 or more samples. Now, this is not a situation that other places didn't face. What I've described there could have been described from New York or northern Italy or any number of places on this planet over the last year. The issue now is how do we get the necessary support, both within and outside Brazil, to support. But this is not just, if you look at the epidemic curves, and as I said, in Paraguay and Uruguay and Chile, and in Argentina, the whole southern cone and all the way up to the Mercosur countries in Central America as well. We've seen a rapid exponential increase in cases in a number of countries in the Americas. Again, likely driven, as the DG said in his speech, that breaking down of basic behaviour, the increased social mixing, the reduction in physical distancing, fatigue and exhaustion with having to manage those measures. Is driving this, and we're going into waves where, as you can see in the case of Manaus, the hospital and health system has already been weakened by previous waves, and therefore harder for them to suffer a second, third punch. So the situation is difficult, and in this case, in the case of the southern cone of Central and South America, it is not new variants driving this transmission. New variants may have an impact down the line, and they may be having some impact now, and Maria can speak to what we know about that. But again, it's too easy to just lay the blame on the variant and say it's the virus that did it. Well, unfortunately, it's also what we didn't do that did it. And we have to be able to accept our share, individually and as communities, as governments, our share of the responsibility in this virus getting out of control, while recognising the variants in the virus make it difficult. I've said it before. The opposition has put substitutes on the field. It has more energy. The virus has been energised by the ability to evolve and become better and fitter and better adapted to infecting us. We have got to get more efficient at fighting the virus. There are no easy or other answers. Maria, you might want to speak to. And again, our solidarity is with the government and the people of Brazil. It's entering, obviously, with other countries in the Americas, a very difficult phase. We will, as an organisation, as always, do everything to support our member states and everything to support the people of Brazil. Maria.
Thanks, Mike. So just some comments on the virus variants that are being reported. So there are some virus variants that have been reported from Brazil, and we're working directly with researchers and scientists and amazing public health professionals in Brazil They have very strong scientific work, sequencing capacities, and as Mike said, we met with our colleagues in PAHO today to get an overview of the current situation. With regards to the virus variants, there is a virus variant that has been reported. They're delineating this, the P1 lineage. I won't go into many different names, but just to say there are several in Brazil, but also in other countries. This mutation, this variant has several mutations that have some known biological importance, the ones you've heard us talk about before, this 501Y mutation and the E484K mutation. I think what we should do, Fidela, is we should plan a specific live Q&A on these so that we can get into the details of this and go point by point, because it's a lot to cover in a very short answer. But just to say that WHO and partners have been monitoring these mutations, so specific changes, one change, or variants, which are a collection of mutations and deletions, and setting up a monitoring framework to evaluate these mutations, variants of interest and variants of concern. We presented this to our strategic advisory group. We've presented this to the R&D, our R&D forum for epidemics. We had an excellent meeting on Tuesday, I think it was Tuesday this week, where we developed a research agenda specifically related to the studies that are necessary to better understand each of these virus variants that are being reported, because more and more will be reported. There's pressure on this virus to change. The more it circulates, the more opportunities it has to change. So while we are trying to get transmission under control, we still have to monitor for new variants. We presented this also to the emergency committee, this risk monitoring framework that we have outlined, where we are working to increase surveillance for the SARS-CoV-2 virus circulation using PCR tests, using antigen-based tests, increasing capacity for sequencing, and there are a number of efforts that are ongoing around the world to increase sequencing capacity. There's an excellent network across PAHO to try to leverage existing systems. There's a system across Africa as well, and we're looking at different ways in which we can enhance sequencing capacity around the world so that we can detect changes in the virus. We're also working with our Virus Evolution Working Group, which you've heard me mention many times, to set up a risk assessment framework to say, okay, we see something of interest, what does this mean? What are the studies that are needed to evaluate transmission, severity, neutralization, and any potential impact on diagnostics, therapeutics, and vaccines, those that are available and those that will be available in the future. We had the R&D research meeting this week to outline the suite of studies that are needed to be conducted, and we're setting up the collaborations to ensure that our partners that work in labs with good biosafety and biosecurity can carry out the research that is needed to answer these questions. And lastly, to make sure that all of this fits into a risk assessment that WHO carries out regularly. We call these our rapid risk assessments. Just so that we can put into context what these variants mean. It's a lot of information for me to give in an answer, but I provide this because it's not just as simple to say we've identified a mutation. There needs to be a system in place to understand what each of these mutations mean, what these variants mean, and how it impacts the behavior of the virus. But as you've heard us say, this virus is dangerous on its own, variant or not. And even if it can provide increased transmissibility, and some of them do, we still have tools that could break chains of transmission. The interventions that have been outlined by WHO that many countries are using, implementing at a local level based on the local situation, work at breaking chains of transmission. Variants and the detection of variants and the emergence of variants makes it harder. But we still have some control over this virus. So the emergency committee reinforced what we suggested in terms of monitoring this on a global level and said that this needs to be strengthened. And so we will work very hard to strengthen that monitoring framework so that we have better eyes and ears on where these virus variants are. And we will also be working on a nomenclature so that we will be able to describe these more eloquently to you as they emerge. So it's a work in progress. There's a lot to do, but we all have to do as much as we can to prevent as many infections as we can and reduce the pressure on this virus.
Thank you, Dr. Simão.
I have a very short intervention because I think what's happening in Manaus in Brazil is actually an alert for many countries, right? Because you have a breakdown, you have a resurgence, but at the same time you have an enormous breakdown on the health system, the structure. And what we are seeing this, as Mike has mentioned, also in developed countries. So it's not just a matter of poor resource settings, right? Manaus had an infrastructure that was put in place for the emergency situation, the horrible, horrific situation we went through in the first semester last year. And because of a false sense of security, this was let down. And I think this is an important alert to all countries. Don't let a false sense of security bring your guard down. If you have built up infrastructure to ICU beds and oxygen distribution points, if you have put that up, don't shut it down. Don't shut it down because it's not over yet. I think we need to learn from what's happening, the terrible situation that Manaus is facing right now. It's, let's say, that we can prevent further damage if we take this message forward and we take it strongly. Don't let your guard down. We're not down. We're not over yet.
Thank you all for your participation. I would like now to invite Dr. Tedros for his final words, and also asking if Dr. Houssin has any final comments to make, please do. Dr. Houssin, do you have any final comments?
No, thank you very much, except to reinforce what said Mike Ryan. Work, speed, and realism are what is necessary at the present time.
Thank you, Professor Houssin. Over to you, Dr. Tedros.
Yeah, thank you. Thank you so much, Fadila. And thank you to those journalists who have joined us today. And bon weekend. Thank you. Until we see you in our next presser.
Thank you, Dr. Tedros, reminding you that you will receive the audio file and Dr. Tedros' opening remarks right after this press conference. The full transcript will be posted on the WHO website as of tomorrow. Thank you and have a nice weekend.